dignitaries on the dais, luminaries in the audience, ladies and gentlemen. The last time I said this, Dr. Ahluwalia said he'd rather be considered a luminary than a dignitary. Sir, you're both. Indeed, India is at a stage in its health transition where we have a multitude of health challenges to confront, and we have rather limited human and financial resources devoted to that. It is absolutely imperative that not only we recognize the magnitude of the challenges, but mobilize all of the societal resources in order to provide an adequate response to these challenges. We are an ancient civilization, but demographically a very young country. As the number of young people and the number of people in the working age population increase, we will find that their health needs are immense, and their health needs to be protected if we have to harness the potential productivity returns from that young population and working age population. At the same time, as has been remarked this morning, our numbers of the elderly are also steadily on the rise due to increasing life expectancy. And they too need to remain fit and functioning rather than frail and feeble. If all the health needs across the life course need to be addressed, then certainly we require a health system which is much better equipped in terms of its resources and capable of extending its outreach and upgrading its efficiency. At the same time, we need pro-health policies in other sectors which impact upon health, because quite often the determinants of health lie in many other sectors ranging from water, sanitation, nutrition, environment, agriculture, food processing, urban design, transport, to cite a few. In order to bring together all of these sectors, and in particular to utilize the resources that are available within the health sector, we need a grand coalition. And this particular conference has been convened in order to create a platform wherein multiple stakeholders can actually converse with each other and then ultimately lead to a consensus that can create a pathway for concerted action. Therefore, this particular conference has representatives of the government, representatives of the academia, the private sector, and the civil society. They form the four pillars on which this large platform actually stands. It is quite clear that some of the perspectives may not necessarily be entirely identical, but the common objective of ensuring that India advances on its developmental agenda while providing adequate care for the health of its people is something that unites all of these stakeholder groups. And it is very important at this point in time, rather than acting in isolated groups and in taking solo action, which is often ineffective, all the groups work together and pitch their resources together in order to achieve the best possible results for advancing our health agenda. This conference has been a fairly unique conference in that sense, that it brings together different groups from India and also different groups from other countries in order to initiate this kind of a dialogue. And the outcomes of this conference, even though they may not necessarily result in all agreed action points by tomorrow evening, at least sets in motion a process by which this consultation will continue and over time bring together everybody into an alliance which will work for India's health and for global health. I congratulate Dr. Srinath Reddy for providing the creative vision of this conference and ensuring that all relevant stakeholders are indeed here present. I believe that this particular conference is a definite step forward in terms of our collective endeavor. On behalf of the Public Health Foundation of India, which as an independent technical body has provided its technical expertise and scientific knowledge to this particular conference, I would like to pledge that we will continue to work with all partners and certainly support initiatives by the government, the private sector, and the civil society, and bring together the academia as well in full force to support initiatives such as these. I again congratulate the organizers of this conference, and as one of the agencies that has been participating in the organization of this conference, I thank Dr. Reddy for having taken this excellent initiative. Thank you.